Assalamualaikum and good morning everyone. And today I will be presenting about how eating disorder impact mental health. This presentation will be discussing about the cause and effect for eating disorder about mental health. Next slide. Eating disorder are serious life-threatening mental health conditions that involve extreme emotion, attitude, and behavior surrounding food, weight, and body image. They are not just about dieting or appearances. They are rooted in complex psychological and emotional struggles. These disorders are commonly begin in teenagers years or early adulthood. So what we can understand is the eating disorder starts around at the young age, teenagers years and or early adulthood, but they can affect individuals of all ages, genders, and background. This type of disorder can affect everyone. According to the National Eating Disorder Association, or people call it NIDA, more than 28.8 million people will suffer from an eating disorder at some point in their life. The purpose of this presentation is to explore how eating disorder impact health, focusing specifically on the psychological and emotional toll this illness take on individuals. So, if we move to the next slide, there are 3 types of eating disorder, each one with a unique characteristic, but all have deep impact on mental health, emotional health. The first one is called anorexia nervosa. Is characterized by intense fear of strict restriction and distortion body image, often resulting in dangerously low body weight. Next one, it's called bulimia nervosa, involves binge eating followed by purging behavior such as vomiting, excessive exercise, often driven by feeling of shame, guilt, and loss of control. These type of people that get eating disorder tend to be less aware about their surrounding. They don't know what they are doing. They feel shame, they feel guilt, they're out of the control. And if we move to the third one, which is called binge eating disorder, include repeated episode of eating large amount of food quickly and in secret, usually without purging, and is often followed by deep emotional distress. Although we can see all of these each have their unique characteristic, although this condition may present differently, they all share common psychological core, which is distorted self-perception, low self-worth, and overwhelming emotional pressure. Right? Eating disorder take a significant toll on mental health, often creating a cycle where emotional distress leads to disordered eating, and disordered eating worsen mental health. Many individuals with eating disorder suffer from co-occurring mental illness such as depression, feeling hopeless, and sadness and worthlessness. These people that have eating disorder tend to have mental disorder with eating depression at the same time, usually about something sad, and also anxiety disorder, constant worry, panic attacks, and obsessive thought, especially about food and appearances. And if we move to the third one, obsessive compulsive disorder, or people call it OCD, rigid rituals around eating, calories counting, or body checking. These individuals tend to be more keen about what type of food they are eating, what type of diet they are getting. These people is really rigid around eating, calories counting. This is type of mental disorder. And the last one is substance abuse, using drug or alcohol to cope with emotional pain. Like I said, people who have eating disorder tend to have mental health issue, and these are the type of things they do. The worst thing is substance abuse. They are using drugs and alcohol to cope with their with their pain, with their suffering that they caused by eating disorder. If you move to the next one, these mental health struggles are often invisible, as individuals may hide their pain behind perfectionism or people-pleasing behaviors. These struggles is not seen by other people. They don't see these people. Like, for example, I see my friend every day going to school, but I don't know if they have eating disorder, because these struggles are often invisible. Individuals hide their pain behind perfectionism. These people tend to want to be perfect and please to look at the people's eye. They think, I want this because this please people. I want to be beautiful. I want to be handsome. That's why eating disorder exists in the first place. The people-pleasing behaviors, perfectionism. And second one, if you move to the internal dialogue, is often dominated by self-criticism, shame, and negative body image. These people is shame of themselves. They feel this because I don't want to eat a lot. I don't want to get fat. That's why they have eating disorder in the first place. They are dominated by self-criticism, shame, and negative body image. Much scrolling on social media can also cause this type of behavior. They think about the things they saw on social media. They think, this body is perfect. I want to be perfect like this. This body is the ideal body for a man. Let they know, in the end, it's gonna be eating disorder. They're gonna starve themselves. That is gonna cause a lot of mental health problems. And over time, this individual may experience emotional numbness, difficulty concentrating, sleep problem, and even dissociation. This individual gonna be sad, don't feel anything. They're gonna be not concentrating at school. They're gonna have sleep problem or even dissociation. So if you look at the statistic, research shows that eating disorder are closely linked with mental health conditions that can be extremely dangerous if it left untreated. Around 70% of people with eating disorder also suffer from clinical depression. Approximately 60% have co-occurring anxiety disorder, according to National Institute of Mental Health. And if you move to the next bullet point, a 2009 study from the American Journal of Psychiatry found that individuals with anorexia, which I said again, a type of eating disorder, are 80 times more likely to die by suicide than the general population. People who have eating disorder are 80 times more likely to kill themselves because of this type of illness. 1 in 5 deaths related to anorexia is due to suicide, making it one of the deadly psychiatric illnesses. This type of illnesses can cause people to kill themselves, can cause emotional numbness, like I said again. They can cause emotional unstable. Despite these alarming numbers, many individuals go undetected or untreated because society often focuses only on physical symptoms, ignoring the underlying emotional pain. If I go back to the slide, I said that this type of illness are invisible. People don't see this with naked eye. That's why these alarming number go undetected, untreated, because they are invisible in the first place, and people only focus on physical symptoms. They ignore the underlying emotional pain. Social emotional effect. Eating disorder deeply affect not only physical health but also a person's emotional stability and social relationship, often creating a cycle of shame, isolation, and disconnection. Many individuals begin with withdrawal from society activities, especially those involving food, out of fear of being judged, pressure. Over time, this can lead to chronic loneliness and strong sense of misunderstood. this type of individual tend to be, after a long time of eating disorder, their fear of being judged, being pressure. If I eat this, like for example, if I eat this burger right now, I will be fat and someone will judge me. That's for example. And this disorder also can lead to frequent mood swings, including irritability, sadness, and emotional numbness, which can make everyday interaction exhausting. These people that have eating disorder will tend less to socialize with other people. They don't want to socialize because they feel shame, they feel hate. Many of these individuals with eating disorder report feeling ashamed of their eating habits and guilty after meals, which cause them to hide behaviors or lie to loved one. This secrecy increases emotional stress and erodes trust in the relationship. And over time, this disorder can lead to loss of personal identity. As individuals become consumed by rules and number and routines related to food, appearances, this emotional turmoil may lead to self-harming behaviors, substance abuse, or suicidal thought. Like I said again, this eating disorder can cause them to kill themselves, can cause them to don't want to socialize with other people, especially when the person feels trapped or helpless in their situation because of the intense internal battles with schools, work, hobbies. These people may suffer struggle with low motivation, poor connection, and emotional burnout. That's all from me. I give this presentation to Mujahid.
Thank you, Athir, for your good presentation, explanation about eating disorder. So now, I will be continuing our presentation by explaining how societal pressure and biological factors contribute to eating disorder. Okay, so this topic matters deeply, not just because eating disorder impacts our physical health, but it also known as one of the most complex and devastating mental health condition ever known to humans. So, eating disorder don't just develop out of nowhere. They are the result of interaction between environment and biological influence that cause eating disorder to happen. So today we will be exploring how societal pressure and biological factors contribute to eating disorder and how does they shape eating disorder in a different way. So first of all, we start with societal pressure. What does it mean? What is societal pressure? Societal pressure refers to the expectation, the norms, the imagination of people pushed into individuals by media, by Instagram, by TikTok, by culture, by friends, peers, family, partners, and groups. This can influence people how they want to behave, how they want to eat, and how they want to look in a certain way. Moving to the next slide. There are 4 pillars in societal pressure. So the first one is social environment, beauty standard in society, societal disconnection, and lastly, misconceptions and stigma. And I will be explaining each by each. So the first pillar is social environment, the outside force. Why do I call it the outside force? It is because this happened externally. It happened in our surrounding, in our communities, and even in our families. While genetics create a tendency for eating disorder, but a person's environment like friend, stress, bullying, tension, feeling of sadness, and others can push these people toward these unhealthy eating habits. Our emotion like feeling sad, happy, stressed, or being bullied, and social triggers like I said, friends, peers, family, and environment are the first and often the starting point of this unhealthy disorder. Next slide. Moving on to the second slide, we'll be explaining about the second pillar, which is beauty standard in society. What does beauty standard have to do with eating disorder? So first, society's unrealistic beauty standards play a huge role in this problem. Okay, so based on the picture I give you, I show you about the skin tone of different people and how people look. So why? What does it have to do with this? First, when people are exposed to this unrealistic beauty standard, they may have developed a feeling of inadequate, or in a simple words, the feeling of not enough. This feeling, which build up over time, will cause the step toward eating disorder. Social media, advertisement, and celebrity culture constantly reinforce or telling message that unattainable body ideas, making people feel that their looks are never enough. But real life doesn't look like Instagram, TikTok, and Facebook. While these influencers post this unattainable body, flawless looking, and filtered image, real bodies, our bodies, are complex, diverse, and unique in their own way. The contrast between what we see and what we are can become emotionally damaging. This message creates a harmful comparison and a constant feeling of inadequacy in people's mindset. Moving on to the next pillar. The third pillar is societal disconnection. What does it mean? But first, societal disconnection is the lack of engagement or the lack of interaction or socializing with people. A study by Vitalino 2021 found that individuals with eating disorder reported heightening anxiety, depression, and loneliness due to the increased environmental stress and reduced access to support system. Many that were cut off from therapy, support, or even normal social interaction that previously happened helped them to cope. This disruption that were caused by people and by the depression, anxiety, and loneliness make recovery even more challenging. Moving on to the last pillar is misconceptions and stigma. What is misconception and stigma? So misconception and stigma is what people think and what people thought about eating disorder. And it's also one of the biggest obstacles to recover in eating disorder. This is why does misconceptions and stigma is the most hard and challenging one obstacle to recover from eating disorder. This is because a lot of people nowadays see them as a choice rather than a really serious and devastating illness. This prevents early interventions and worsen isolations. So, OSFED, or known as other specified feeding or eating disorder, represent nearly 40% of eating disorder cases among males and almost 45% higher among females between 2018 and 2019. And these numbers are increasing nowadays. This challenge the misconception that only anorexia and bulimia matter and shows how under-recognized and diverse eating disorders really are. So now we will move to biological factors. There are two pillars in biological factors. And so the first one is the role of genetics and neurotransmitter and mood. So the first pillar of biological factor are called role of genetics, the inside force. Unlike societal pressure, which is the outside force, role of genetics is the inside force that happen in our body, which is very hard to face and change. Some individuals may be genetically predisposed to developing an eating disorder. This means some people are born with a higher risk of getting an eating disorder even before any outside pressure like friends, people conception, people mindset, stress, bullying and others. Having this risk doesn't mean they will develop an eating disorder for sure, but it makes them more vulnerable towards them. And the last pillar for biological factor is neurotransmitter. What is neurotransmitter? Neurotransmitter is a chemical that our body can live without. Neurotransmitters send message or signal to every part of our body, including our muscle, nerve, and so on. According to Baraka 2023, imbalance in gut microbiota, neurotransmitter, and hormones contribute to eating disorder symptoms and related psychiatric disorder. Neurotransmitter are chemical messenger, like I said, in the brain, like serotonin, for example, that control our mood and appetite. Serotonin, a transmitter that regulates our mood and appetite, is often dysregulated in people with eating disorder. When our serotonin levels are off the charts, people can feel anxious, depressed, loneliness, stressful, and have problems controlling their hunger or feeling full. So now I will be pass my friend to explain the solution to this problem.
Alright, thank you my friend Mujahid for the presentation just now, and now I am hafiy and I will lead you through the solutions to eating disorder. Now there are 4 types of solutions that can be taken to help solve this problem. First of all, there are psychological treatments, nutritional and medical intervention, biological and genetic understanding, as well as awareness and media literacy. So for the psychological treatments, there are 3 types, which are cognitive behavioral therapy (CBT), dialectical behavioral therapy (DBT), as well as family-based therapy (FBT). So, what is cognitive behavioral therapy or CBT? CBT is a structured time-limited therapy that focuses on identifying and challenging distorted thinking. It identifies and changes negative thought patterns and behaviors, and it can help people with eating disorder by replacing irrational beliefs with healthier thoughts. Basically, people with eating disorder often have a lot of misconception about how eating food will affect them. Like, for example, some people will think that eating any kind of fat is bad and then they will gain weight very fast. So we need to change this perception so that they can eat a lot more effectively. The next one is identify triggers for disordered eating. Now, there are quite a few number of triggers that causes this disordered eating. For example, stress, bullying, and so on and so forth. So, through this therapy, we can help them to properly address their problems and effectively eradicate their eating disorder. And last but not least, develop better coping skills. Some people cope with stress and bullying and so on and so forth by eating. That is not exactly a healthy thing to do. You eat, and you gain weight. That is true. And through this therapy, we can introduce them to cope with their stress through better means like hobby or working we have dialectical behavior therapy or DBT, which is useful for individuals who struggle with emotional regulation, self-harm, or intense mood swings. DBT helps manage intense emotions, tolerating stress, and improving interpersonal relationships. It's also especially helpful for those who use food to cope with emotional pain. Now, it might seem similar to CBT, but there are some differences where CBT is used in identifying and changing negative thought patterns and behaviors, while this one is for managing intense emotions, tolerating distress, and improving interpersonal relationships. And the goal also is also quite different, where CBT is used to reshape thoughts and to change behavior, and this one is to challenge acceptance, to balance acceptance and change it to improve emotional regulation. And the next one is FBT or family-based therapy, which involves family members in the recovery process, basically to allow the person who is suffering with ED to really communicate with their family members and share their problems. And it is also particularly effective for children and adolescents because, as we all know, children and adolescents, they need to feel listened. They feel like they need to be heard, and they need guidance from their parents and siblings to help them to deal with this problem. And lastly, it reduces secrecy and isolation. Just like how I said it just now, it's through this interaction with their family that they can help solve this problem. And the next one, next slide, which is nutritional and medical intervention. Now, the first one is nutritional rehabilitation. The goals are weight restoration, where it can help patients who are suffering with either extremely low body weight or extremely high body weight to get back in shape and function better. Next one is stabilizing eating patterns, basically repairing their eating schedule from just eating whenever they feel like it to a much more structured way. And lastly, rebuilding healthy relationships with food. Just like I said it before, some people just perceive that eating some kind of food is bad for them automatically. They just never eat that food again, and that is not healthy. That is not how we live. The key strategies are through meal planning. We plan what they eat in a day according to the food pyramid, which is a balanced way of eating. And next is creating regular eating schedules. And lastly, through food exposure. What is food exposure? That is a therapy where we expose patients with certain foods that they might not be familiar or they might not even be willing to try. For example, there are some kids who only eat fried foods like nuggets, french fries, burgers. That is just not healthy. So we need to introduce them to a variety of food types such as vegetables, carbohydrates, and proteins so that they can grow better and as well as help manage their body weight. And there are also supportive approaches which is through nutritional counseling, which helps patients to overcome food fears and guilt and understand how food supports mental and physical health. Next is through education, where patients learn about macronutrients and how each fuels the body, like how carbohydrates help to supply your body with energy. The fat is basically your stored energy. The protein is used to help your body to grow, and vitamins and through vegetables and fruits and whatsoever. It's for other stuff that will help your body to grow. And lastly, through portion normalization, which is teaching what normal portion sizes look and feel like. And next slide, which is medical stabilization. This step is essential for individuals who are in a critical physical condition due to their eating disorder. When it's needed, It's for people who suffer with extremely low weight or body mass index, irregular slow or slow heart rate, fainting, severe dehydration or electrolyte imbalances, organ dysfunction, as well as people who suffer with self-harm or suicidal behavior due to this eating disorder. Now there are 4 steps in this guide, which is hospitalization, which is used for life-threatening cases, aka people who suffer a lot more serious cases, and patients are monitored around the clock by doctors and nurses. Next is feeding programs, where controlled increase in food intake are given to avoid refilling syndrome. And what is refilling syndrome? It is a metabolic disturbances which occurs as a result of reinstitution of nutrition in people who are starved, severely malnourished, or metabolically stressed because of severe illnesses. When too much food or liquid nutrition supplement is consumed during the initial 4 to 7 days following a malnutrition event, the production of glycogen, fat, and protein in cells may cause low serum concentration of potassium, magnesium, and phosphate. These electrolyte imbalances may cause neurologic, pulmonary, cardiac, neuromuscular, and hematologic symptoms, many of which, if severe enough, could result in death. And the next one is monitoring vital signs, which is regular checks on heart rate, blood pressure, and body temperature. Last but not least is through supplementation. Patients may receive vitamins and minerals intravenously or orally to correct deficiencies. Oral intravenously is for patients who suffer more chronic symptoms of eating disorder, and orally is through taking the supplements through your mouth, just like how you would with vitamin C. So the next slide, which is biological and genetic understanding. Some individuals inherit genes that are more vulnerable to developing eating disorders. Now this has been explained by my friend Mujahid, and there are some reasons why this matters, which is to change our perceptions on people who experience eating disorders. EDs is not as a lack of willpower, but as a medical illness with neurological roots. It helps families, schools, and communities to be more empathetic and less judgmental. And lastly, it encourages integrated care that includes medical, nutritional, and psychiatric support. Now, this can be achieved through conducting genetic and neuroscience research, school and university curriculums, as well as spreading information through media. Next slide. Which is awareness and media literacy. Now, media can be harmful through constant exposure to ideal body types like thin, muscular, or flower skin, which promotes unrealistic beauty standards. These images on social media are often edited, filtered, or digitally enhanced, and this causes celebrities and influencers to cash in and promote fat diets, detox products, or weight loss activities that are harmful and unproven. And lastly, before and after photos or body transformations like this one, so it can trigger negative comparisons and body dissatisfaction. While this sort of comparisons, this sort of body transformation can be inspiring, it can also be, on the contrary, it causes more problems than it helps. And what media literacy teaches is, first of all, critical thinking, which makes you question what you see in advertisements, Instagram posts, or fitness influencers content. Next is understanding manipulation, which is learning how companies use Photoshop, lighting, and angles to sell beauty or fitness ideas, which in turn allow you to recognize false promises in a weight loss marketing. Lastly, it helps to build self-worth, which is teaching that worth is not based on appearance solely, and it also encourages appreciation for body diversity and functionality over appearance. Next, which is the conclusion. Eating disorders or EDs are serious mental health conditions and are not just about food or appearance. They result from a combination of biological, psychological, and social factors. EDs are severely impact both mental and physical health, often leading to long-term damage or death if untreated. Genetics, brain chemistry, and gut health can increase a person's vulnerability. Recovery requires a holistic treatment approach. And with the right support and societal change, recovery is possible, and individuals can get health, confidence, and fulfilling life. And next is for the question and answer section. I will give this to my friend Athir.
Thank you for all my friends for that amazing presentation. Now for question and answer session. Anyone got any question?
Me.
Alright.
So this question is directed to Athir. My
Yes.
question is, should the government stand up about overcoming this eating disorder? Okay.
Thank you. I think that's a great question. My answer is yes. Government should step up to help with this eating disorder. Not just government, also NGO, which is known for non-government organization. They should work together to overcome this eating disorder case. Do you think I answer your question?
Yes, I think it's very clear that you answered it. Okay, so my next question is for Mujahid. Why is it important to raise awareness about the stigma surrounding eating disorder?
That's a good question, Haris. Thank you. Okay, so because the first one is the stigma or misconceptions around the eating disorder is that people think they see eating disorder as a choice, not just a serious and devastating and also a complex mental illness. So therefore, by raising awareness about eating disorder, how to prevent it, is there a cure, is there a solution, therefore helps people to find help, go to hospital, and therefore prevent more case like eating disorder to happen. Does that answer your question?
Yes, Mujahid, thank you so much for the answer. Okay, so my last question for Hafiy. How can nutritional rehabilitation help treat eating disorder?
Alright, thank you for that question. So basically, for nutritional rehabilitation, we will slowly fix back their eating schedule, their nutritional intake, and as well as introducing new nutrition so that they can take much more. They can take nutrition much more effectively, so that everything is in balance, so that their body can function properly and that their body weight is in check. Does that answer your question?
Yes, thank you for the answer. Okay.
That's the end of our presentation, and thank you for listening to us. Assalamualaikum.